If you wake up every morning with lower back pain, stiffness, or discomfort that lasts all day, the problem might not be your chair, your mattress, or even your exercises. Often, it's something much simpler: how you sleep at night. Today, we're going to explore the worst sleeping positions for lower back pain, why they harm your spine and muscles, practical ways to fix your sleep posture for relief, simple adjustments you can start tonight. By the end of this video, you'll know exactly how to protect your back while sleeping and wake up feeling refreshed and pain-free. Why your sleeping position matters. Your spine isn't just a stack of bones. It's a complex structure of vertebrae, discs, muscles, and ligaments. When you sleep incorrectly, even for hours each night, it can cause compressed spinal discs, muscle tension in your lower back, poor posture reinforcement, chronic pain that worsens over time. Doctors and physical therapists emphasize that how you position your body while sleeping is just as important as your daily posture and exercise routine. Worst sleeping position for lower back pain. Number 1. Sleeping on your stomach. Sleeping on your stomach may feel natural to some, but it's the worst position for your back. Why it's harmful? Forces your neck to twist sideways for hours, creates excessive arching in your lower back, strains spinal discs and muscles, can lead to stiffness, soreness, and even nerve compression. Fix it. Try sleeping on your back or side instead. If you can't stop stomach sleeping, place a thin pillow under your pelvis to reduce arching. A soft, flat pillow for your head helps reduce neck strain. Number 2. Sleeping without proper support. Many people lie down directly on a soft mattress or a flat surface without supporting their spine's natural curve. Why it's harmful? Your spine sags, increasing pressure on discs. Muscles have to overcompensate to hold alignment. Leads to pain in lower back, hips, and shoulders. Fix it. Use a medium firm mattress that supports the natural curve of your spine. A pillow under your knees when sleeping on your back can relieve lumbar pressure. Side sleepers can place a pillow between the knees to align hips and spine. Number 3. Twisted or curled up positions. Fetal positions can feel cozy, but curling up too tightly can increase pressure on the lower back, restrict diaphragm and breathing, cause morning stiffness and soreness. Fix it? Keep your body relaxed and spine elongated. Slightly bend knees, but don't curl excessively. Use a supportive pillow to maintain natural alignment. Best sleeping positions for a healthy back. Number 1. On your back with support. Place a small pillow under your knees to maintain the spine's natural curve. Keep your head supported with a medium thickness pillow. This distributes weight evenly and prevents pressure buildup. Number 2. Side sleeping. Recommended for most people. Use a firm pillow between your knees. Keep your legs slightly bent, not tightly curled. Hug a small pillow or body pillow to reduce twisting of the spine. Keep your head aligned with your spine, not tilted forward. Number 3. Avoid sleeping on your stomach. Only try if you place a thin pillow under your pelvis and lower abdomen. Additional tips to reduce back pain while sleeping. Invest in a good mattress. Medium firm mattresses are ideal for most adults. Replace old mattresses every 7 to 10 years. Supportive pillows. Cervical pillows for neck support. Knee pillows for side or back sleeping. Stretch before bed. Gentle hamstring stretches. Lower back stretches. Cat-cow stretches to relieve tension. Mind your sleep environment. Keep the room dark and cool. Avoid sleeping with arms under the head, which twists your neck. Daily activity matters. Strengthen core muscles to support your spine. Walk, stretch, and do light exercise regularly. Common mistakes people make at night. Sleeping in one position for too long without movement. Using thick, unsupportive pillows. Ignoring persistent pain and not adjusting posture. Overlooking mattress quality. Making small adjustments can dramatically reduce back pain over weeks, improve sleep quality, and increase energy during the day. Success stories and motivation. Many seniors and adults have dramatically reduced chronic lower back pain just by adjusting their sleeping position. After switching to side sleeping with a knee pillow, I no longer wake up stiff. Back pain that lasted for years is finally gone after I added a small lumbar pillow. Even small daily changes can lead to life-changing relief. Conclusion: to summarize, avoid sleeping on your stomach. Use supportive pillows for knees and lumbar spine. Choose the right mattress for your body. Keep your spine aligned, not twisted or curled. Incorporate gentle stretches before bed. By making these simple adjustments, you can protect your lower back, sleep better, and wake up pain-free. Thank you for watching. If you found this video helpful, please like, subscribe, and share it with someone who suffers from back pain. Remember, proper sleep posture is a simple but powerful way to reduce chronic pain and maintain a healthy spine. Start tonight and feel the difference tomorrow.